We are checking in with Bethany Retirement Living today. Dawn Hummel, the Senior Executive for Resident Care, and Carmen Swenson, the Unit Manager for Transitional Care, joins us this morning. Welcome, ladies.
Good morning.
Good morning.
So, first of all, we need to learn a little bit about transitional care and the rehab services that Bethany offers.
Okay, thanks for having us. This is Dawn. I'll maybe start off, and Carmen, you can jump in. We have a transitional care unit, which is a rehab unit, very medically based unit where we have short stay patients that come and stay with us for an average length of stay of about 2 weeks to 20 days. And so we're pretty proud of that unit and really focus on getting people ready to go back home after a hospital stay. And being as strong and as confident as they can when they leave our building. I don't know, Carmen, if you have anything more to add on that.
Yeah, and I think with the transitional care unit, we see a wide variety of patients coming from the hospital, patients that are post-stroke, orthopedic surgeries, wounds, wound vac, PICC line, IV therapy. So there's a wide variety of patients that we do take care of on a day-to-day basis that I think sometimes, not everyone knows about. So we are really proud of the things that we can do here and to help care for the patients that need it.
Okay, and we're seeing, on our screens here, a lot of equipment and so forth that looks fantastic. But I know that there's more than just, physical therapy type kinds of event or, activities that you can do there too. But what are the different kinds of therapies there?
So we provide physical therapy, speech therapy, as well as occupational therapy, and that's licensed therapists that are seeing the patients. One of the things that makes it pretty unique for what we do here is that the patient's going to have a primary therapist, both physical and occupational therapists, that will see them from day one almost until the time of discharge. So they get a very good relationship built. And so the therapists are really a key piece of it. You want to talk a little bit about their day?
Yeah, yep. So typically the TCU patients start their morning, kind of like you and I, breakfast, getting ready. Usually have a therapy session in the morning, and then we go into lunch, and then they'll have another therapy session, one of the 3 disciplines that we do, and then just kind of continue with their day. A lot of patients are focusing on getting back home and being as strong as possible getting home. So we see a lot of the therapy that is done to plan for discharge home to make them as successful as possible. So they're kept pretty busy with therapy throughout the day. Typically on average, 2+ hours of therapy is what we shoot for on a day-to-day basis for our patients.
And then how to navigate some of those things, like you said, Carmen. How am I going to negotiate stairs? How am I going to make sure that I can use the restroom? I mean, all of the things that may be some barriers, they're going to work with them in the gym. We have one of the largest gyms in the Fargo-Moorhead area. So when they get down to that therapy session, they're really working, and that 2 hours a day is pretty intense. But it's what they want. I mean, our goal is to get them home, like Carmen said.
Yeah, that's the key phrase right there. So
it is.
Yeah. How does Bethany's therapy and rehab services then differ from some of the other places in the area?
Well, I think, I think one of the things that's key is that we have a reputation of having a transitional care unit or rehab unit. We've done this for over 10 years now, and so our reputation is very strong, and so we have a different staffing ratio in that TCU. We don't refer to people as residents, they're patients. It's very medically focused. We have a very high nursing coverage, nurse presence in the TCU. So, they're very similar to what the hospital staffing ratios are going to be. That's one of the key things, I think, Carmen, and how we are different.
Yep. They're very patient focused. We have medical providers in the building, pretty much daily during the week to kind of help with any questions or things that might, need to be done with our patients. So, we really try and focus patient-centered care, getting them home, assessing their needs, and just getting them on their way to be successful.
Our TCU also, we can do all of their follow-up appointments. So they do go to appointments while they're here for those, 14 to 20 days. They will continue going to appointments. We coordinate all of that. I think one of the things that's so nice about the TCU that sets us apart from others is that the families are also a piece of this. And to be honest with you, many families struggle with how would I get somebody from the, discharged from the hospital sitting at home, how would I get them to and from all of these appointments that they've got those first 2 to 3 weeks? And that's, I think, one of the critical things that makes us very successful is we partner with the families to make sure that this person's going to be very successful when they leave here, versus just sending them home without any kind of a plan. It's hard. Most of the family members are working 2 full-time jobs. So how do you get somebody to and from all of these therapy, physician, all of these appointments? It's difficult.
Yeah, thank you, ladies. It looks beautiful, like a beautiful location. Thank you for taking the time today to be with us.
Absolutely. Thank you so much for having us.
You are very welcome. Coming up on today's show, a message for all the happy couples who are looking to get married soon.